Hi there, it's Dr. Pete Putnam from ESSA Health. I want to congratulate all the parents whose children are about to graduate from high school. It's graduation season here in St. Louis, and you've done a great job of getting your child ready to become an adult, because that's one of the big objectives of parenthood. And even though your job doesn't end, I wanted to take a moment today to answer a question a lot of parents have about when it's time to graduate from the pediatrician's office. And so, believe it or not, that process actually in most pediatricians' offices starts a lot earlier than graduation day. It really starts in the early let's say 11 to 12-year-old age range, when pediatricians start preparing both the child and the parents for this transition. It's not sort of an immediate event. Instead, it's more of a prolonged process to get a child ready to take care of themselves when they're at the doctor's office. So at that initial visit in the 11 to 12-year-old time, when they're in for their annual checkup, the pediatrician will take some time to talk to the parents and talk to the young person about the fact that their body will be changing, their mind will be changing, and that the young person can start to take more responsibility and initiative into their own health care. The way that practically works itself out is that for the next several years, as they come through in the teenage years for their annual checkup, for at least part of the visit, usually the pediatrician will invite the parent to leave the room so that the young person will have some time by themselves with their doctor to learn how to ask questions of the doctor and answer questions of the doctor, to understand that connection that a patient can have with their physician, which is really at the heart of healthcare as ESSA Health sees it. Some kids, as you can imagine, are ready for this sooner. Some kids, it takes a while. At age 16 specifically, in our offices, we ask a kind of standard questionnaire to make sure that that young person knows what medical conditions they have, knows what medicines they take, knows how to get an appointment from a doctor's office, whether that's calling on the phone or using the internet or other tools that we have, to really get that person ready to take care of themselves when they're approaching the age of 18. Obviously, when they turn 18, they're sort of officially an adult in the eyes of the government, and at that point in time, many young people are ready to make the transition. You and your child should talk to your pediatrician if the pediatrician doesn't share that directly. Some pediatricians really do decide that 18 is the cutoff date, so to speak, and would recommend transitioning at that age. But others of us will see the child until about age 21. So that's something that's going to be a little bit different depending on who your doctor is, and you should talk to your doctor about what age your child should be ready for that. But when it's time, once the pediatrician and the child and the parents, who are now sort of moving out of the picture a little bit, feel like the transition is ready, in our offices what we're able to do is get you connected with an ESSA Health internal medicine or family physician who can provide the same great care for your young person as a young adult, just like we took care of them as a young child. So that's kind of the process. So it's a little bit, it's sort of in the 18 to 21-year-old range is when most young people are going to move from a pediatrician's office to an adult provider.